be able to sit with me and talk about this for just a minute. And like I told you when I talked to you originally, you sent the card in requesting information. I'm the person that was assigned to provide the information for you. And what I'm going to do is try and make it really simple to understand, because a lot of folks say it's confusing. That's because they never did it before. I explain it all the time, and it's really very simple. This is the guidebook on how to choose a Medigap policy. It's a guide to health insurance for people with Medicare. This is the official government guidebook. It has important information about what the supplements are, what they cover, your rights on getting them, and how to get one. And if you'll look at your little red, white, and blue Medicare card, this picture is the same picture that's on your little red, white, and blue Medicare card. So what I want to show you is I don't have anything up this sleeve. I don't have anything up this sleeve. I'm just going to read what this book says because it explains it better than I ever could. Okay? And the first thing I want to show you is there's two ways to skin a cat. This is the old-fashioned way, or the original way. And then this is the new way. The appointment that I have with you today is to talk about this, and that's what that card was about, is the original way. And what most people do is this. I work with a pretty big group, and we do hundreds of applications a week. Almost everybody does this. A few people do this, and I am licensed to do this and could explain it if you needed information on it. Now, there's two parts to Medicare. A is hospital and B is medical, doctor. Most folks take original Medicare when they turn 65, and then they get a drug plan to help cover their prescriptions. And most folks will get a plan to help pay what the Medicare doesn't cover. It's called a Medicare supplement. Sometimes it's referred to as a Medigap policy, and we're going to be talking about them for the next few minutes. It doesn't take really long. It's really simple once you look at it. Now, the other option is called a Medicare Part C. You see here we have A and B and D. Here's the C part. And what C does is it combines together A and B, these two parts, and usually a Part D prescription drug plan as well. And if you join a Medicare Advantage plan, you can't use and can't be sold a Medicare supplement or Medigap policy. You can't get one of these to complete. So you have deductibles, you have co-pays, and on most of these plans you have an out-of-pocket maximum that could be really high, as much as $6,700. And they're like a HMO or a PPO, which means there may be doctors that you have to use those doctors, and if the doctor you want to use isn't on the list, you just can't use them, or you have to pay for him out of your pocket. Folks think that that's a real disadvantage because when they're sick, they don't want a doctor shop based on who takes the insurance. What they want a doctor shop based on is which one will do the best job of taking care of them. I want to look at this paragraph and go over it with you. It's pretty doggone simple and easy to understand, and this really clarifies most everything about what we're going to talk about today. Every Medigap policy must follow federal and state laws designed to protect you, and the policies must be clearly identified as a Medicare supplement. That's why when we look at this brochure, you see that it's written in huge letters that it's Medicare supplement insurance. And that's big enough print anybody can see it. Now, Medigap insurance companies in most states, except for some states like Massachusetts, Wisconsin, and Minnesota, all offer a standardized Medigap policy designated by letters of the alphabet A through N. Each standardized policy must offer the same basic benefits no matter which insurance company sells it, and cost is the only difference. So these were all standardized, and the reason is it was done to protect you, and that's very important. This was done for your benefit and to protect you, and they're all the same except for the cost. Now, in picking plans, there's a dozen of them to choose from, and it's really kind of confusing if you look at all 12 of them, but if you look, it's only one that covers everything that Medicare does not cover. Now, if you do it in most states, they call that a Plan F. If you do it in Massachusetts, where some of our friends are from, they call that a Sup 1. The core plan does not cover a lot of different things. And getting back away from Massachusetts, but most of the rest of the country, you'll see all kinds of gaps in the boxes. Okay, and here you got a plan that covers 50% or 3/4 or something like that. Now, I've never met anybody that was half sick. I've never met anybody that wanted half of their bill paid. And I've never met anybody that wanted to get half better. That don't even make no sense. I bet you somebody in government figured all that out. But the Plan F, as you see here, pays 100%. And it's kind of hard to understand on that book. So what I've done is I've had this card printed up, and it makes it really easy to understand. Here's your Part A, and here's your Part B. Let's go over them together real quick. It's not hard. Hospital is Part A. You have a deductible. It's over $1,100. Plan F pays 100%, and you don't pay anything. If you're in the hospital past 60 days up to 90 days, Medicare will pay everything but $283 a day. You owe 100%. Plan F pays everything. Now, I was pretty bad at math in school. My teachers just passed me because they didn't want to put up with me the next year. But if you can tell me how much 0 plus 0 is, Josh.
0.
Pretty simple to understand, isn't it?
Mm-hmm.
Now, if you stay in the hospital past 90 up to 150, you could owe $566 a day. It pays 100%, and you pay 0. It'll even pay an additional 365 days after Medicare stops at 151. So you get about a year and a half where 100% is covered and you don't owe anything. If they ain't cured you, they might have killed you. If they didn't do either one, they'll probably ship you out to a skilled nursing facility. Now, my mama broke her hip. She was in the hospital. When she got out, she went to a skilled nursing facility. You have to have been in the hospital for at least 3 days, enter the facility within 30 days of hospital discharge, and receive skilled nursing care for the same thing you were hospitalized for. For the first 20 days, Medicare pays all of it. You don't owe nothing. For the next 80 days, you owe about $140 a day. It pays 100%. You still don't pay nothing. So that's a year and a half in the hospital. It's 100 days in a skilled nursing facility and hospice, all covered at the rate of 100%. You don't pay nothing at all. Now, Part B is your doctor doings, and that's physician services, outpatient care and tests, supplies, surgical services, physical speech therapy, diagnostic tests, and etc. They knew I wasn't the sharpest knife in the drawer, and I might not remember what etc. was. So to help me out, they put it on the card. It's home health care, it's blood, and it's outpatient. You got to take care of 3 things: the deductible, the 20% to go with Medicare's 80%, and some doctors will demand excess charges. They can't charge more than 15% more than Medicare approves of, but they can ask for that, and you are responsible for paying it. Plan F pays 100%, including the home health, the blood, and the outpatient. So you got a year and a half in the hospital, 100 days in a skilled nursing facility, and you are fully covered on doctor, inpatient, outpatient, sickness, accident. If it's something that's medically necessary, you're fully covered. Now, it won't cover elective stuff. So if you decide you're getting droopy in the drawers and you want a Brazilian butt lift, you're just going to have to take your wallet and pay for that yourself. Outside of the continental United States of America, it becomes a true major medical 80/20 after a $250 deductible. So you owe 20% and $250. I've had multiple clients in the time that I've been doing this wind up needing care and treatment outside of the country. Every one of them has been covered. So just to review, this is the official government guidebook that's put out by Medicare. That's the picture that's on your Medicare card. It don't get much more official than that. There's 2 ways to do it. We're talking about the old-timey way that most folks do it, because this one not all the doctors take, and you could wind up with some serious out-of-pocket. This one, it pays it all, and you don't owe nothing. Every Medigap policy must follow federal state laws designed to protect you. They've all got to be clearly identified as Medigap insurance. All the plans are the same. Cost is the only difference, and they figured that you might not have believed them when they told you the first time, so they're going to tell you again. Comparing Medigap costs, because that's what everybody wants to know about, is the price on this thing. As discussed on the previous pages, the cost of Medigap policies can vary widely. There can be what kind of differences, Josh?
Big differences.
There can be big difference in the premium that different insurance companies charge for what?
Exactly the same coverage.
Exactly the same coverage. Now, I'm a reasonable fella, and I think that you're a fairly intelligent person and that you probably understood exactly what I was saying, but I'm going to give you the benefit of the doubt and help you on this. Now, look here. There's about 36 companies in your zip code that offer it. One of them has the highest price and one of them has the lowest price. And in case you miss something, they're all exactly the same except for the price. Do you want to buy it from the company with the highest price? Look at my head now, Josh.
No.
Okay, or your other choice is to buy it from one in between, or you can get it from the company with the lowest price. Which makes the most sense to you?
The lowest price.
Every time. That makes good sense. So right about now, everybody has one question.
What's the cost?
Usually they want to know which company, and we recommend A-rated companies with the lowest price. In your zip code, the company with the best price is AARP. I'm sure you've heard of them before, right?
Yep.
Terrific. And you already asked how much the cost was, right?
Yep.
I'll be glad to tell you. What's your zip code? Do you use tobacco or not? Quote the premium. Never, ever quote the premium if they don't ask. You can say that question. Everybody wants to know the same thing over and over and over again, and many people will not volunteer that question the first time. But if you tell the premium before they ask, about 50% of the time, you ain't got them, which means that you probably need to go back and say, official government guidebook, here's the picture, review one more time, tell them what you're going to tell them, tell them what you told them, make sure we're all on the same page. Don't you have any questions for me, Josh?
No.
Everybody asks one question.
How much does it cost?
There you go. I'm so glad you asked. Don't get no easier than that, does it? That's it.